the resurgence of COVID-19 in Victoria and the mood of panic in that state. Last night I presented 5 reasons as to why I think the decisions and failures of the Andrews government has directly led to the spike in clusters of infections. And no need to canvass all of that again, Richo, but you just wonder whether all of this is spooking even those in charge. Now, today on ABC Radio this morning, the Victorian Health Minister, Getty, seemed to be blaming language and ethnicity for the new infections.
And we've also had a very multicultural component to those parts of Melbourne as well. And perhaps some parts of the community may not have received all the messages around public health as well as the rest of the community.
Now, I would have thought Melbourne's language or cultural difficulties are no different and probably less than what exists in the larger city of Sydney. I think it's an excuse. What's your call on that, Richo?
It certainly has that ring to it, I've got to say. But I don't understand what more the Andrews government can do. Look, it's like every government with this COVID, you just do your best. But there's going to be outbreaks and you can do little about them. We don't know where the next one will be. New South Wales, Queensland and Western Australia, who knows? But you can bet it'll come. You are going to get spikes. And it's not a matter of then finding someone to blame. Blame the bug, don't blame the politician. I
thought, though, they went soft on the Black Lives Matter protest, and Victorians saw that as their invitation to congregate. It just wasn't given the serious level of concern that we saw in New South Wales. No one went to a Supreme Court, to try and stop it. No one threw the police in their thousands to disperse the crowd, as they did in the second protest in Sydney. I thought that was a major message to Victorians. And just another thing about the minister. There was the minister's confusing explanation today about suppressing the virus. Have a listen closely to what she says on the ABC. She was almost suggesting that the National Cabinet may have been wrong.
What we've seen, of course, is the National Cabinet agreed to a suppression strategy, not an elimination strategy. Mm-hmm. Our states have been fortunate in that they've managed to get down to zero, and I congratulate them on that. But we knew that because we had that suppression strategy that was agreed to nationally, as we started to ease up restrictions, we did anticipate that we would see outbreaks and new cases, and that was acknowledged by Brendan Murphy. It's been acknowledged by the Prime Minister and many others.
Richo, I get the feeling that she is dirty and maybe Daniel Andrews is dirty because of the pressure that was on them to reopen at a time when they didn't want to reopen. What was your feeling about that statement?
Yeah, I think that Andrews would happily have kept the place locked down for weeks longer, and I've thought that all the way through. Obviously, though, they were forced to move, and you can see from Getty that there's that bit of resentment still lingering in the air.
Yeah. About what to do now, though, I was watching Professor Mary Louise McLaws on Sky News this morning. Now, she advises the World Health Organisation, and she's got this latest research on the virus, which is showing that as nations reopen, having a policy about wearing masks have not only been important, but they're becoming successful.
WHO released a new guideline for masks based on new evidence, but also based on the evidence of what happens after restrictions are lifted and where social distancing can't be kept. So public transport, shopping malls, aeroplanes, those sort of areas, and anywhere like a stadium. So we need to teach the community how to use a mask, how to put it on safely, how to take it off with clean hands.
See, ever since June 15 in London, if you're on the tube and you're not wearing a mask, and by the way, they hand them out freely, you'll be hit with a fine because police are on all the platforms. They are serious about wearing masks in this reopening. These are the kind of decisions based on this new research that has been accrued from the last few months that states like Victoria probably need to get up to speed with and act on. Now, meanwhile, this is really important. Professor McLaws was very keen today to lower all of our expectations about a vaccine. Now, in the US, their top infectious diseases expert, Anthony Fauci, said today he expected a vaccine to be available in 6 months. Now, Professor McClaws said not so fast. She explained that 54 countries have poured $8 billion into a vaccine, into this pursuit. There are now 13 trials still standing, which have a further 2 stages to go before that eureka moment hopefully happens. And then there's the long and exhaustive process of manufacturing large-scale vaccines.
Can you imagine the time it will take to not just produce the vaccine, but to roll out a program? It took 20 years to call smallpox, completely eradicated. And of course, let's hope that it won't take anywhere near that amount of time, but it will take longer than just 18 months and even 2 years.
Richo, I know everyone's been saying that, we've only had 4 infections that have emerged from this Black Lives Matter protest in Melbourne, but I read some of the detail today about one of those protesters who ended up going to the H&M clothing store and infecting people there. A person from there went to a dental clinic and infected staff there. They're now tracing back as to whether dental clinic staff have infected other people. It does not take much for this to get out of control. No,
it doesn't. I mean, it spreads so damn easily. That's the difficulty. You don't have to try hard to catch it, and that's why it's so insidious. It creeps up on people and they don't realise it. And I don't know what we can do more, though. I mean, look, there are so many ads about it. There's apps and ads and God knows what else. I think we're trying very hard. The only thing I note, though, is that I still don't own a mask. And I've still yet to wear one. And maybe I spend too much time inside, but I haven't worn one yet. Have you?
No, and it's probably something that, for those of us who are a lot older, would see it as a daggy thing to do. But I would have thought if I'm getting on a train or a bus in this environment and I'm in Victoria, I'd probably wear a mask, and maybe that's something they need to look at.